everybody, I'm back. We didn't quite make it on Tuesday. This Tuesday we were been pretty busy. I think we were busy. Erica? I think we were. We didn't get it done anyway. So it's Thursday. I'm not sure if you'll see me online today, if we'll put this up next Tuesday. It doesn't matter. But let's talk about pediatric dentists today. I've been talking about specialties a little bit, and one thing that some parents, not all parents, but some parents, and I can understand why, can be a little frustrated if we have to refer your kiddo to a pediatric dentist, and there's various reasons they do that. Sometimes the child may have extensive needs, like they might need to go to the operating room, they might need a lot of work on their baby teeth. Probably the most common question I get about that is, the baby teeth, you're going to get permanent teeth, why don't you just take them out? Well, we can't do that for a couple of reasons. One is your child has to have something to chew on and feel good in there and support the cheeks, but really the baby teeth are there as a guide for the permanent teeth to come in. So if you lose them prematurely, oftentimes it can cause the adult teeth to come in the wrong place, and then you really cause a traffic jam when the permanent teeth come in. So we need to keep them there as long as possible, and they're important for the health of your child. They can become infected too, and those infections can be hard to treat, so pediatric dentists can do that. Like I said, sometimes they'll take a child to the operating room in a hospital under general anesthesia to treat. That's pretty rare, though, that we see that. It's usually, I might refer a child who has a couple cavities here or there. I might refer them because they're really fearful. Pediatric dentists are just a gift. They do a great job. They have small chairs. They have offices that are really kid-friendly. They make it seem more fun. They'll use the nitrous, sometimes the laughing gas for a child. And I don't know how they do it. Smoke and mirrors and poof, they get things done. Sometimes, though, honestly, parents, I'll tell you, I think some children will still maybe have a not-so-good experience if they have to get shots and things done in there. Some kids will lay there like nothing, and others really have a difficult time. And it's more important to me that your child has a decent experience in my office than the tooth itself. Meaning, like, I'll see adults that I have to sedate, and generally it's because somebody hurt them when they were a kid, and they remember that, and they're fearful to come to the dentist for the rest of their life, which is really a thorn in your side because it's so important to come every 6 months, and sometimes adults will put that off because of a childhood experience, and they have this snowball of problems all their life. So trying to make the experience as good as possible for your kid is my goal, and sometimes I know it's not going to be great, even at the pediatric. I just feel like it might not be great. Then my office is still an okay place sometimes for the kid to come every 6 months. So parents, you're not going to have that fear of what's going to happen at Dr. Skow's office or Dr. Connor's office, because we try to stay the good guy, so to speak. Sorry, pediatric people, that I do that sometimes, but generally they're so good with the child, better than me, that they do have a good experience. But we try to stay the good guys so that you kids want to see us for treatment. So I think the main thing I want to say about pediatric dentists and how we work with them is that it's to create a good experience long term, so that over the course of your child's life, they're not scared to come to the dentist. That's the main goal, more so than doing a filling on a tooth or doing a crown on a tooth. It's experience of your child. So that's pediatric dentists, if you even know they exist. Sometimes I won't see people till they're 18, 19. They've been going to a pediatric dentist this whole time, and that's great too. But they're a really great resource, so help me help you if I want to send you to a pediatric dentist. Thanks.